Welcome. I'm Kevin Morse. I'm a co-chair of the TMA Chicago Communications Committee. And on behalf of the Communications Committee, I'd like to welcome Suzy Koenig of SAK Management, a platinum sponsor of the TMA Chicago. Welcome, Suzy.
Thank you. Thanks, Kevin. I appreciate it.
Thank you. It's great to have you. And thanks for taking the time to tell us a little bit about SAK and everything that you've been doing. So as an intro, why don't you tell me a little bit about SAK?
Sure. Well, SAK Management Services is a strategic advisory in healthcare and senior housing. And we do consulting and turnaround. We have a nationwide reach, and we work in all phases of healthcare. We're very hands-on, and we do receiverships, Chapter 11 trustee. We manage for several senior housing third parties and long-term, not just short-term. And we specialize in turning around healthcare facilities. We can work with single asset hospitals or multi-senior housing facilities. We've given expert testimony for the government. We've been, again, a court-appointed receiver, examiner, a monitor, Chapter 11 trustee, and a patient care ombudsman, as well as operate facilities.
So there are a couple of buzzwords that you said there that really seem pretty pertinent over the last 18 months of our lives. Healthcare, senior living. I can imagine that, your focus on healthcare probably had a different experience than a lot of us in the restructuring and distressed area. Why don't you tell me what the last 18 months have looked like for you at SAK?
Well, the last 18 months for most people kind of sitting back and relaxing in their basements or at home. We have been on the firing line, literally in COVID-rich environments like crazy, full-time PPE and everything. I mean, I personally was on the phone with China throughout the entire day and night, trying to secure PPE for 3,000 or 4,000 or 5,000 nursing home beds throughout the country. We even got all new clients. One of our portfolios was about 3,000 beds. We literally got the month before COVID came out. And then during COVID, at the height of COVID, we took on 6 other more facilities where the debtor was allegedly going to get indicted for check hiding. And we ended up, I got court appointed as the receiver, but actually ended up managing the facilities through a sale process. We did the first virtual auction that I think our investment bankers have ever done. And we came out with a really great prices. And thankfully, we were able to maintain the asset during the COVID period of time. We actually even increased the reimbursement, the CMI scores. So we were able to sell on a high note when we thought it was really going to be distressed when we initially got into the portfolio.
That's amazing. So normally in a situation like that, a receiver comes in and you'll take over the asset and day-to-day management. But I can only imagine that the emergency that you walked into, how did you handle that? I mean, getting PPE for you said 3,000 beds and, trying to make sure that people were socially distanced or it's somewhat, I can't imagine, walking into a debtor case or a receiver case is drinking out of a fire hose at the beginning anyways. Like, what did you do? I mean, as COVID was hitting and senior facilities were truly, the hot spot for this. How'd you approach that?
Yeah, well, I'll tell you, it was tough. My team, thankfully, they've all, been in the firing line in the past. So they know what it's like to drink out of a fire hose, as you would say. But walking in to this situation where obviously people didn't know that life and death was always thought upon. I was worried for my own staff when COVID came out. It's not like we knew any more than anybody else. We were just like the hospitals. And so we ended up, trying to get PPE, and all of the healthcare suppliers put a lot of the companies on allocations based on what they bought previous years, when obviously PPE wasn't even considered except in rare instances. So it was quite crazy. The allocations obviously wouldn't even come close to what was needed. So I had to hit the ground running, figure out who I knew, import exporters, across the world. And we ended up partnering up with some folks actually out of Singapore, who I knew through a friend, through another business associate. And I was able to secure PPE and high quality PPE at best. I had people in the factories literally checking it out before it got shipped at the ports. I was getting texts and emails from China, pictures, my name on the box of in China in the port. It was crazy.
That's,
It was like states were fighting against each other, countries were fighting against each other. We were literally like fighting Italy and fighting Spain, and Europe for the same supplies, because there were just very few suppliers out in Asia that supplied all this.
that's an amazing story, and what a unique perspective that you and SAK had, throughout the pandemic. And, luckily, knock on wood, where vaccines are rolling out, and, hopefully we're at the end of this. So now that we're kind of, hopefully at the end, where do you see this going? How do you see, COVID changing healthcare, restructuring, your area? What are you seeing? What are you hoping to see?
Yeah, so
Yep.
it's crazy. I met with bankers this morning, and we talked a little bit about appraisals, and we talked about things that, I think what's super important when there's businesses, because there's a lot of businesses right now, especially healthcare in distress, and you just got to look at the numbers. Look at that COVID was a snapshot in time, and it's not a permanent thing. And but restructuring is certainly important, for healthcare businesses to get someone who is obviously trained in this and can get in there and understand staffing. How we are really short. Every industry has limited amount of employees. These surplus programs that were created by the government were a great thing in the beginning, but they have to end soon, because too many people are just not working. You can go and see for yourself, restaurants and all different types of businesses, but healthcare is so affected. The lower level CNAs and the nurses, there's just not enough, and agency is being used. So the expenses are enormous. So what's important is having a healthcare turnaround person in there that understands the industry, that can be creative, and that can look at it from literally the long view, being able to analyze the operating analytics, how the services are provided, reimbursed, the referral systems, the service area, understanding the regulatory compliance, because the government is coming out just big time, trying to make up for all the time that they couldn't be in the buildings, following up on complaints and things that happened years ago at this point. So again, cost containment is important. And the decrease in the elective surgeries put a real null for the hospitals, as well as the skilled nursing facilities. They couldn't provide all of the orthopedic care that they were providing. And now these things are slowly coming back. It's not coming back all at once, as you would maybe think it would, but everyone is still very slow and skittish. I don't think senior housing is going to come back for at least another good year. We're looking at pro formas. We're being very conservative on what we're telling our clients. Expenses, we're being super creative and trying to attract people back to the industry. And, the government just has to work, not by giving money out. That's not saving the businesses. Saving the businesses is giving them the opportunity to really bounce back. And, there's sources of funding out there, and there's people that are able to get deals done. But again, I think there's more sellers right now than there are buyers. There's a lot of people circling around and trying to figure out what to do. But again, there's people out there that can execute because, several smart people did all the right things during the pandemic. But again, it's a tough industry. So if businesses are looking to hire someone that has healthcare background and understands all the metrics.
And it sounds kind of what I'm hearing is, well, I would say hire someone now. What I always say is people hire debtors counsel way too late. Hire
Way too
someone
late.
now before the dust settles so you can get ahead of it, right? And
Right.
be prepared for, when everything starts ramping up again. And
Yeah.
hopefully someone like you could have their finances in the right place and, operations ready to go once everything kicks back into high gear again, which I hope is sooner rather than later.
We all hope it's sooner rather than later, but getting ahead of the game is the way to go, putting the plans in place and really, being able to execute immediately. So hiring earlier than later, we always say that, but I think banks now and lending institutions and equity partners, they do see that. I hope they do. So, you got to be able to plan. All of a sudden, we're opening up. All the conferences now are going to be in person. Meetings are in person, but everyone should still take the necessary precautions of getting the vaccine and wearing masks in certain places where it's necessary.
I 100% agree. Well, thank you so much, Suzy. I really appreciate it. I think you have a really unique and interesting story and all the great work that SAK has done and continues to do, and your continued support of TMA. So thank you so much.
Thank you, Kevin. Thank you so much for allowing me to speak and being a part of this. TMA is a
Absolutely.
wonderful organization.
Thanks.